Hello, I'm Ulrika Wolf, a clinical hypnotherapist and strategic psychotherapist. In this short briefing, I want to clarify what clinical hypnosis is, how it may be used therapeutically, and some of the factors health practitioners may wish to consider when referring a patient or client. Clinical hypnosis, also known as clinical hypnotherapy or just hypnotherapy, is a structured therapeutic method that uses focused attention, imagination, suggestion, and mental rehearsal to support an agreed therapeutic goal. Despite common misconceptions, a person does not become unconscious or surrender control during hypnosis. Patients generally remain aware of what is happening and can speak, move, disregard a suggestion, or even stop the experience at any time. This is one of the most important distinctions between clinical hypnosis and entertainment hypnosis, also called stage hypnosis. Stage hypnosis is designed to entertain an audience and usually involves carefully selected volunteers, social expectations, and pressure to produce a visible response. On the other hand, clinical hypnosis takes place privately within an agreed therapeutic framework, and suggestions are linked to the patient's or client's goals, consent, and clinical needs. I find it useful to describe hypnosis as a form of concentrated therapeutic rehearsal. A person may understand intellectually how they would prefer to respond while continuing to repeat a pattern. They may know that a situation is safe, but still experience a strong fear response or a disproportionate fear response, like getting a needle and fainting, or genuinely intend to change a habit but find themselves repeating it. Hypnosis can provide a focused setting in which a different response is imagined, experienced, and rehearsed. However, hypnosis is a method rather than a complete treatment strategy. In my work, it's integrated with strategic psychotherapy. This involves identifying the processes maintaining the person's difficulty, what they repeatedly do, where they direct their attention, how they interpret the experience, and which attempts to manage the problem may unintentionally be reinforcing it. And that happens more often than you think. The therapeutic strategy is developed first. Hypnosis may then be used to strengthen, rehearse, or consolidate that strategy. People commonly seek support for habits, smoking or vaping cessation, situational fears, stress and rumination, sleep difficulties, confidence and performance concerns, chronic pain, medically assessed gastrointestinal symptoms, menopausal hot flashes, and distress associated with procedures or anticipated events. The strength of the evidence varies considerably by presentation. Comparatively stronger evidence has been reported for selected applications involving pain, medical procedures, and some disorders of the gut-brain interaction. Evidence for other applications may be a bit more limited, mixed, or dependent on the specific intervention being used. As such, I don't present clinical hypnosis as a universal treatment or a guaranteed solution or cure. When considering a referral, it may be appropriate in cases where your client or your patient has a reasonably clear therapeutic goal, where relevant physical causes have been medically assessed, and hypnosis is intended to complement rather than replace existing care. The person should also be sufficiently stable, able to provide informed consent, willing to participate, and have realistic expectations about treatment. A formal referral is not generally required. However, referral and collaborative care can be particularly valuable where there are relevant medications, medical or psychiatric diagnoses, multiple treating practitioners, diagnostic uncertainty, or other clinical considerations that should inform treatment planning. Additional assessment or specialist involvement may be required where there is active psychosis, significantly impaired reality testing, acute mania, delirium, substantial dissociation, cognitive impairment affecting consent, acute suicidal or self-harm risk, severe psychological instability, or complex medical or psychiatric comorbidity. It's currently outside my scope of practice to work with those conditions. However, generally, a history of trauma or a mental health diagnosis is not automatically a contraindication. Suitability depends on the person's current stability, goals, risk profile, and the competence and scope of the treating practitioner. Hypnosis should also not be used as a method of establishing the historical accuracy of recovered memories. Suggestion can increase confidence in a memory without demonstrating that the memory is factually accurate. Following a referral, the first appointment begins with assessment rather than immediately proceeding into hypnosis. I always consider the patient's goals, their relevant history, their current treatment, their medications, risk factors, and the patterns that may be maintaining the difficulty. Only then do we develop a therapeutic strategy, and we use hypnosis where appropriate and where there's consent, and integrate the experience and establish the relevant between session practice. Patients remain active participants throughout this process. Overall, clinical hypnosis is neither magic nor simply relaxation. It is a structured therapeutic method whose value depends on appropriate assessment, a relevant strategy, patient participation, and practitioner competence. Thank you so much for taking the time to learn more about clinical hypnosis. You can read the full briefing on the Online Hypnotherapist Clinical Briefings Hub.
The Clinical Briefings Hub is a free, dedicated professional resource for GPs, specialists, and allied health practitioners who would like more detailed information about clinical hypnotherapy, strategic psychotherapy, and referral considerations. The Clinical Briefings Hub is a separate space that allows you to explore the complete evidence-informed briefings behind the information on the main website. When you open a briefing, you will see the estimated reading time at the top so you can decide whether to read it now or later. Each briefing also includes call-out summaries that highlight important clinical points and practical information for quick review. The content is divided into clear sections, allowing you to move to the information that is most relevant to you. You can also expand or collapse sections as needed and skip to the sections that are of most interest. You can also review the supporting sources in the footnotes and click directly through to available research, professional guidance, and further reading. The complete briefings include all three collections, foundations, clinical presentations, and the referral process. And you can see there's far more here as well for you to access. Health practitioners can freely access the clinical briefings by subscribing to the Online Hypnotherapist Professional Updates.